I've been doing my PhD at the Institute for Manufacturing in the Center for Technology Management for the last 3 years now. And as part of my PhD, I look at innovation by global health entrepreneurs. In July last year, I had this idea of wouldn't it be great if I could get all the entrepreneurs I've studied in the same room together to try and answer some of the questions I was having on their business models for innovation. And we were able to put together this conference today, April 19th and 20th in 2012.
It brings together people who are focused on poverty, on healthcare, on medical devices, on funding mechanisms. And it's often hard to get those people from really different backgrounds in the same room, speaking the same language.
But when you do manage to get together a group like this, it's amazing how many ideas can spark and can fly around the room.
If you don't have a healthy population, then they probably aren't going to be able to go to school and really learn the skills that might help with development. If you don't have a healthy population, then they probably won't be able to work as well and then contribute to essentially their community and their society as far as development is concerned.
For most people in developing countries, they'll get sick and sometimes die without ever knowing what it is that caused that sickness. That's something that we feel is an unacceptable problem.
The truth is that I think a tipping point has come in global health where extraordinary opportunities have arisen, many of them primed by an amazing amount of philanthropy. But at the end of the day, it requires real companies doing real things.
Companies can deliver good value to their shareholders and make a meaningful contribution in all the societies they operate in, and this does not need to come at the expense of profits.
What I think is important today and on this panel, and I hope that you will challenge us, as to what do we really see about innovation? And for us, where we see the innovation is that provision of attacking market failure and public good provision failure, so that you're no longer treating the poor as passive recipients of aid, but actually as customers.
Coming from academia, we talk to industry, we collaborate with companies, mainly small companies, but we don't take products to market, we give them on someone else to do. So to actually think about the whole cycle has been fascinating.
You've had incredibly skilled people with a depth of experience in global health, all talking together across different sectors, and getting those people together in one room means you're going to have great conversations and great discussions.
This is about building companies, it's about building revenues, and it's about enabling countries to ultimately become self-sufficient.
We need someone who can express the anguish of the patients, and I think we need a lot more people to join in, and with your support, the fight goes on.